Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the osteology of the fibula. The fibula is a thin long bone of the leg which lies lateral to the tibia. The fibula does not transmit body weight directly. Anatomical position and side determination. Head is slightly expanded, is above and bears a circular articular facet. The apex of the head or the styloid process projects upward from the posterolateral aspect of the head. The medial surface of the lower end or lateral malleolus bears a triangular articular facet for talus anteriorly and the deep malleolar fossa posteriorly. This is the head, this is the styloid process, this is the neck, this is the shaft of the fibula. Okay, so let us get it now. Okay, this is the head, this is the styloid process, this is the neck is here, this is the shaft, and this is the lateral malleolus, the facet for the talus, malleolar fossa, and we have the malleolar groove here. Okay, for the passage of the fibularis longus, fibularis brevis muscle. Okay, we got that. Okay, so we'll go to the next slide now. Okay, these are the identification. Again, we have the head, neck, styloid process, articular facet, the shaft here, the lateral malleolus, and we have the interosseous membrane connecting the fibula to the tibia, superior aperture for the passage of the anterior tibial vessel, inferior aperture for the passage of perforating branch of the fibular artery. Okay, and we have the fibula and tibia forming the leg bones. Okay, so if we go to the border, we'll get the anterior border. Here is the anterior border is here, anterior border, and we have the posterior border here. We have the interosseous border here. Okay, so the anterior surface between the anterior border and the interosseous border. Posterior surface between the posterior border, interosseous border. Okay, the lateral surface between the anterior border and the posterior border. Okay, we got that. Now, you go to the next slide here. These are the identification: head, neck, apex, fibular shaft, lateral malleolus, malleolar fossa, articular facet of lateral malleolus, groove on the posterior surface of the malleolus. We have to identify this all with some ligaments. Okay, like the fibular collateral ligament at the apex of the fibula, and around it we'll get the insertion of biceps femoris. We have also tibiofibular ligament, anterior posterior, talofibular ligament in the lower part. Okay, and the calcaneofibular ligament at the margin of the malleolar fossa, the lower part, and we have the ligament of the fibular head in the upper part. It will articulate with that of the lateral condyle of the tibia. Okay, so here we got there. Here is the muscle origin. This is the muscle extensor digitorum longus, then extensor hallucis longus. This is the fibularis tarsus. These all are extensor muscle innervated by the deep fibular nerve. On the lateral aspect, we'll get the fibularis longus muscle like this. This is the fibularis longus muscle, and we'll get the fibularis brevis. They are innervated by the superficial fibular nerve. Okay, if you go to the posterior aspect, we'll get the origin of the soleus muscle. Here is the origin of the soleus muscle, the posterior aspect. We have also origin of the flexor hallucis longus, and we have this is the flexor, and part of the fibularis brevis from the lateral part. It is going a little bit posteriorly here. Okay, these are the muscle. Okay, so here is the okay, so if we go there, okay, here is the muscle extensor digitorum longus. Here this is extensor hallucis longus. They are coming from the fibula. Okay, here also we have the fibularis tarsus muscle. Here there is the small muscle fibularis tarsus. There is also an extensor muscle. Okay, on the lateral aspect we have the fibularis longus, fibularis brevis muscle. They make a groove on the posterior part of the lateral malleolus, and this lateral muscle innervated by the superficial fibular nerve, extensor muscle innervated by the deep fibular nerve. Okay, so here attachment to the head, apex, fibular collateral ligament, and insertion of the biceps femoris around the fibular collateral ligament in a C-shaped manner like this. This is the fibular collateral ligament. This is the insertion of the, we can say, insertion of the biceps femoris. This color is red. Usually by convention insertion is blue color. Okay, we got that. Now we have capsular ligament of the superior tibifibular joint. Relationship is very important. The common fibular nerve is related to the neck of the fibula. Here is neck of the fibula for the relationship to that of the here is the neck is related to the common fibular nerve. If it is paralyzed, then what will happen? We'll have foot drop. Person cannot dorsiflex. Okay, we got that. Okay. Attachment of muscles on the fibular head, we just discussed that. Extensor digitorum longus, fibularis longus, biceps femoris. Attachment of ligament on the fibular head, capsular ligament of the superior tibifibular joint, fibular collateral ligament. Neck of the fibula is constriction immediately below the head of the fibula. Relationship of the neck of the fibula is very important. Common fibular nerve is related to the posterolateral aspect of the neck of the fibula. If it is damaged, we will have foot drop. Okay. Shaft has three borders, anterior, posterior, and interosseous. We just discussed that part. Medial, lateral, and posterior surfaces. Okay. Border, anterior, posterior, and interosseous border. Three surfaces: medial surface, lateral surface, and posterior surface. Attachment of the anterior border, anterior intramuscular septum. Attachment to the posterior border, posterior intramuscular septum. Attachment to the interosseous border, interosseous membrane. Okay, we got that. And on the anterior border, we have also attachment to the superior extensor retinaculum. The lower part will have also attachment to the superior peroneal or fibular retinaculum. Okay, so here is the fibula, the lateral muscle, flexor hallucis longus. The tibialis posterior. Tibialis posterior takes origin from both the tibia and fibula plus the interosseous membrane. Okay, and soleus muscle takes origin from the tibia, from the soleal line of the tibia and the posterior 1/4 of the fibula. Okay, this is the soleus muscle. This is the tibialis posterior muscle, flexor hallucis longus muscle. Okay, and if you look at that, the neck is related to the common fibular nerve, very important. If it is damaged, then there will be foot drop. Okay, Common fibular nerve has two divisions. One is the deep fibular nerve, the superficial fibular nerve. Deep fibular nerve supplies the extensor muscle like extensor digitorum longus, extensor hallucis longus, peroneus tertius. It also supplies the tibialis anterior. The superficial fibular nerve, this will supply the fibularis longus and fibularis brevis muscle. These are soleus innervated by the tibial nerve. Okay, so lateral surface lies between the anterior and posterior border. Attachment of lateral surface we just discussed. Fibularis longus, fibularis brevis, also called peroneus longus, peroneus brevis. Medial surface of the shaft of the fibula lies between the anterior and interosseous border. Attachment to the medial surface of the shaft of the fibula, extensor digitorum longus, extensor hallucis longus, and fibularis tertius. Okay, posterior surface the shaft of the fibula lies between the interosseous and posterior border. Attachment tibialis posterior, soleus, flexor hallucis longus. Attachment to the lateral malleolus of the fibula, we have the tibiofibular ligament anterior posterior, talofibular ligament anterior posterior, and at the lower part of the malleolar fossa, attachment to the calcaneofibular ligaments. Okay, blood supply of the fibula is from the fibular artery. The nutrient artery is coming from the fibular artery. It is very important to supply the fibula. It enters the fibula on the posterior surface. Ossification is very important to us. Ossification, one primary center of ossification, two secondary center of ossification. And primary center of ossification appears 6th week of intrauterine life. Secondary center for the lower end appears during the first year and fuses with the shaft by 16th year. Okay, a secondary center for the upper end appears during the 4th year, fuses with the shaft by the 18th years. So this is the violation of the law of ossification. Here it came first, it should unite last, but it came first, secondary center, it unite also first than that of the secondary center of the upper end.